Welcome to the Operations Center here at ECU Health. I'm excited to be able to tell you a little bit about what we do here and how we service our organization. First, let me tell you a little bit about ECU Health. We are a non-hospital system based in rural eastern North Carolina. A lot of people don't know that our geography is the size of the state of Maryland. And if you only have 1.5 million people, that pretty much shows that it's a very rural environment. We have hospitals that are 6 beds, all the way up to an academic medical center that's over almost 1,000 beds. And the coordination of care across our system of care to make sure that our patients receive the care they need is anchored by this operations center. Across those 1,800 beds that I was referencing earlier, there is a lot that goes on to make sure a patient gets in the right bed at the right time. Again, we want the patients to get all of the care they need, but really none of the care that they don't need, right? And so that's why we exist. On the left-hand side of our room here, this is our transfer center, and this is staffed by nurses, right? And so it's critical that a nurse answers the phone to triage whatever might be going on. What a lot of people don't know is that that phone rings over 1,000 times per day. And so in any given year, upwards of 400,000 phone calls occur in this room. And that is, again, to coordinate the care of the patient. You might have a doctor in a rural community setting on one end, and you might have a specialist here at the trauma center on the other end. Those doctors collaborate. The nurse is on the phone. They're capturing the discussion. They're documenting in our EHR, which is Epic. And then based off the decision of those physicians, we move on to the next step. If the physicians agree that that patient needs to come to Greenville, that moves over to our bed planning side of the room. It takes a lot of coordination. So if we know a patient is coming in for an orthopedic surgery case, there's only certain areas of our system that they can actually be placed. And we have a whole team of staff that do that all day long. They're constantly monitoring the ED arrivals, the OR schedules, the direct admits. A patient might be in a doctor's office and the doctor calls and says, hey, I need to admit this patient. They are constantly monitoring that so we can get patient to a bed as quickly as possible. In the middle of our room are our patient flow facilitators. They are also nurses. I like to equate them to the supervisors of the room. They're kind of running this entire operation, if you will. The analogy I like to use is their job is to put the puzzle together, but the puzzle is upside down, so they don't know what the picture looks like, and the puzzle pieces are always changing shape, but their job is to put the puzzle together. And again, this happens all day long, 24/7, 365, really, if you want to think about it. And it is essential to the healthcare that we provide. All of this does about 20,000 transfers. So about 20,000 times a year, we will move a patient from point A to point B, whatever that might be. It could be a community hospital to a community hospital. It could be a regional hospital to the medical center. It could be the medical center out of state, depending on whatever's going on with that particular patient. It's really exciting part of what we do and how we contribute to patient flow and patient care across Eastern North Carolina. Providing care to this region is truly our mission. To prove the health and well-being of Eastern North Carolina is real, and it takes everything this organization does to make that happen. Even teams like this that are behind the scenes coordinating flow is critical to making sure patients receive the care that they need. So I'm honored to be able to show this to you. We certainly invite you for a visit if you're ever in our area, and if you have any questions, please don't hesitate to reach out.